Hi, my name is Tori and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means I treat things that can go wrong around the pelvis, and this includes sexual dysfunction. If you haven't, please do check out the very first video in this series, as it speaks more about what is considered normal and abnormal surrounding female libido, and it outlines my intentions behind creating this series, which in short are to walk you through how I would approach treating low libido as a patient who is also a pelvic health provider. Now, because we are focusing on psychology today and how it might affect low libido, I do want to reiterate my intentions and be very clear about my expertise. I am not a mental health provider and I have no formal training in the field of psychology. Again, my intention is to walk you through how I might go about assessing different psychological aspects that might be affecting my libido, that might be contributing to low libido if this were happening to me, not to give you mental health advice because I am not qualified to do that. So, with that being said, today we will be discussing 3 psychological categories that I would want to examine within myself if I were struggling with low sex drive. The first would be my relationship with myself. The second would be my relationship with sex. And the third and final category would be my mental health. Before we unpack those categories together, I want to remind you of the mind-body connection and how it might affect sex. In the scientific world, we've broken sex down into a very simplistic cycle: desire, arousal, and orgasm. Desire is something that we feel. It originates in our minds. The wanting, the yearning, the excitement surrounding an upcoming sexual encounter. Arousal is something that we experience. It's something that happens in our bodies. Blood flow to our genitals, increased lubrication in our vaginas, that sort of thing. You can imagine the sort of mind-body state that encourages desire and arousal. It's a relaxed and open and playful sort of place. With that being said, you might also be able to imagine how certain emotional or cognitive experiences that we're having could interfere with that relaxed, open, playful state, that ideal mind-body place. A more palpable example might be worry. Worry doesn't really lend itself to openness and relaxation in the mind, and it tends to manifest in the body as tension or rigidity. So through the lens of desire and arousal, worry could really interfere with that ideal, relaxed, open, playful mind-body state. Finally, I do want to share that should you discover that your psychology may be negatively impacting your libido, I have collected some provider directories for you in the description below to help you find providers that do have the expertise in this field to help you heal. Links to those directories and any other resources that I mentioned today can be found in the description below. All right, now that we've talked a little bit about the ideal mind-body connection to promote sexual desire and sexual arousal, let's shift into those 3 psychological categories that I mentioned earlier that I'd want to examine within myself if I were struggling with low libido. Let's start by talking more about how your relationship with yourself might negatively impact your sex drive. The 2 things that I would want to examine within this category are my body image and my self-esteem. Body image, I think, can be further broken down into 2 important perspectives worthy of your investigation. The first being your view of your body, and the second being how you think your partner or partners view your body. Again, I am not a mental health professional, so I can only share how I would go about examining these perspectives within myself. I would begin by asking myself some questions, and then I might try to objectively observe my behavior. I really like to write. It's an outlet that I've found remarkably helpful for myself, especially when it comes to self-examination. I might give myself some questions as sort of writing prompts, and then try to stream of consciousness answer them. And stream of consciousness is just where you write whatever you're thinking, whatever comes to mind, trying to enter into that flow state. And stream of consciousness writing has been really helpful for me in the past. Some questions I'd want to ask myself are, how do I view my body? When I think of my body, what image comes to my mind's eye? What do I like about her? What do I dislike about her? Am I comfortable using the word hate to describe any feelings that I have towards her? And if I am, what do I hate about her? What about her makes me feel confident and sexy? And what about her makes me feel shy or recoiled or embarrassed or uncomfortable? And if answering those questions prove to be unproductive, prove to be kind of unfruitful in helping me piece together how I feel about my body, if I have a poor body image, that's when I would turn to observing my sexual behavior, trying to objectively observe myself. For instance, during a sexual encounter, do I find myself moving purposefully in a certain way in order to maintain a certain perception of my body? Do I notice nervousness or even resistance surrounding a certain part of my body being seen or being touched? Am I concerned about or avoidant of certain sexual positions because I don't want to encourage body rolls or highlight a certain aspect of my body? That's how I'd want to approach further investigating my body image. And I'd want to use similar techniques when investigating my perception, how I think my partner or partners view my body. As far as questions that I'd want to ask myself as sort of journaling writing prompts, I'd want to know, do I think my partner finds my body attractive? Do I think my partner thinks that my body is sexy? And if the answer to either of those questions is no, I'd further ask myself, well, why? Why do I think the answer is no? Is that coming from behavior that my partner is exhibiting, or is that coming from a sort of narrative that I'm telling myself? Other helpful questions might be, what do I think my partner likes about my body and why? And what do I think my partner dislikes about my body and why? And again, if that exercise, if that sort of question and answer exercise proved unproductive, I would want to turn to trying to objectively observe my sexual behavior. I do want to pause here and say that I recognize that honestly answering difficult self-reflection questions and trying to objectively observe your own behavior can both be very, very difficult. When I find myself being critical or judgmental of my thoughts or actions when I'm performing exercises like these, I try to tap into mindfulness, or said another way, I try to treat myself as I would a dear friend. Mindfulness is a non-judgmental state of being. Instead of criticizing thoughts or actions in a mindful state, I'm curious about them. I let them come and go, and I say, how interesting. I want to learn more about why I think that, or I want to learn more about why I acted like that. Instead of, I can't believe I thought that or did that, how wrong and terrible of me, how bad of a person I must be for doing that. And I feel like that same mindful, non-judgmental state of being is easy to recognize in yourself when you try to think about how you approach your dear friends. I won't speak for anyone else, but I will say that when a dear friend confides in me, I don't find myself feeling angry or frustrated or disgusted or overly critical of her thoughts or actions. I find myself curious to understand, and I find that I tend to approach her with kindness in the way that I want to learn more about what prompted that thought or what prompted that action. So that's how I would go about examining my body image. Let's shift now to trying to examine self-esteem. Recall that self-esteem is a sort of self-evaluation of your own worth. How worthy do you think that you are? How much self-respect do you have for your needs and wants and desires? For me personally, I do think that trying to answer questions about my self-worth would be more difficult than trying to objectively observe my behavior, but I would still try. I would still try and ask myself questions just to see if that stream of consciousness type of writing style that I was talking about earlier did produce anything meaningful, productive, or helpful for me. So I might ask myself questions like, do I like myself? If not, why? Do I love myself? If not, why? Do I support myself? If not, why? Am I worthy of pleasure? I'd try answering questions like these just to see where my writing took me. However, if these writing exercises did prove to be unproductive, I would turn to trying to objectively observe both my sexual and my non-sexual behavior and try to find patterns. I do want to pause here and just quickly say that low self-esteem can counterintuitively present itself as a seemingly very high libido, as a sort of hypersexualization. This can take the form of using sex in order to build self-esteem, or using sex in order to build self-confidence, or being overly sexual or over-sexualizing your appearance in order to feel worthy, or even seeing and therefore seeking sex as a sort of approval from others. In this particular video, in this particular context, I'm more interested in how low self-esteem could present itself as low libido, but I did want to mention the other end of the spectrum just in case it's helpful to anyone watching. That being said, one general behavioral pattern that I'd be looking for both through a sexual lens and a non-sexual lens is sacrificial behavior. Through a sexual lens, this might look like consistently sacrificing my needs, my wants, or my pleasure in order to make my partner or partners happy and in order to avoid conflict. Striking a balance where I sometimes have sex with my partner even when I'm not in the mood because I know that he can get me in the mood and I know that we're gonna have a good time and it feels worth it to me is different, I think, than consistently sacrificing my needs in order to make my partner happy. And I'd want to be mindful of that difference as I try to objectively observe potential sacrificial sexual behaviors of mine. Through a non-sexual lens, sacrificial behavior might look like difficulty prioritizing your needs over the needs of others, not sharing your feelings or thoughts in order to avoid conflict, apologizing or feeling guilty for expressing your needs when you do, or having a really hard time establishing boundaries, almost a sort of willingness to sacrifice your own peace or your own mental health for other people. Really trying to identify that sacrificial behavioral pattern that stems from not feeling worthy of certain relationships, of certain acceptance, of taking up a certain amount of space, that sort of thing. And I think that trying to see those patterns within myself, identify them if they do exist, is where I'd focus most of my attention if I were trying to figure out if I have low self-esteem and if that low self-esteem is potentially contributing to low libido or low sex drive. Before we shift into the next category, I do want to remind you that the wonderful thing about body image and about self-esteem is that they are not fixed. Neither of these are fixed. Both of them are malleable. Both of them can change. You can improve upon both of them. And if you do end up identifying that either or both are contributing to low libido, to your decrease in sex drive, whether you choose to find a provider using the directories in the description below, or if you choose to try and start this healing, do this healing on your own, remember that through the lens of the mind-body connection, poor body image self-image and low self-esteem could really interfere. It makes sense how they could interfere with that open, relaxed, playful state that we were talking about earlier. It would be really hard to feel open and relaxed and playful if you're consistently criticizing either your physical body or your worthiness of a certain experience. And I hope that you can see that, recognize it, understand it, and use that understanding to meet yourself with the patience and kindness and honestly love that you deserve as you try to heal. All right, let's now move into the second category that I'd want to focus on, and that is my relationship with sex. I think that this category can be further broken down into three main areas worthy of investigation, and those would be sex-related beliefs and attitudes, previous sexual experiences, and sexual trauma. So sex-related beliefs and attitudes, I feel, are very important to investigate because any sort of feeling of shame or guilt or embarrassment surrounding sexual acts could absolutely interfere with that open, relaxed, playful mind-body state that we've been talking about. And that could make feeling desire or getting and staying aroused really difficult. In investigating this area, I'd really focus my attention on my childhood. How was I raised, and what cultural beliefs surrounding sex was I immersed in as I grew up? Did I grow up in a religion that taught me that masturbation and sex outside of marriage were sinful and bad? Or did I grow up in a family culture that really valued and upheld more traditional family values? Now, let me be very, very clear here. My intention here is not to blame religion or traditional family values for low libido, but rather to encourage that mindful, non-judgmental, curious form of self-reflection and to ask the question, could being immersed in those teachings as a child be affecting my libido as an adult? A potential example of this could be someone who very much still holds that religion or those traditional family values very near and dear to their heart, but who is now married and therefore is in the correct context to start having sex and exploring their sexuality, but is still finding themselves experiencing shame, experiencing guilt because of what they learned to associate with sex as a child. Okay, let's now move into talking more about previous sexual experiences. The reason I would want to investigate my previous sexual experiences if I were struggling with low sex drive is because as humans, we have a tendency to form our beliefs and opinions and feelings about certain things based on our past experiences. It might be that if my previous sexual experiences were consistently unfulfilling or consistently much less focused on my pleasure than my partner's, I might subconsciously or consciously come to the very valid conclusion that sex isn't really that great. And if my subconscious or conscious expectation of sex is this sort of act that demands mental and physical energy of me, but that adds very little value to my life, I think it makes sense that I might start to have difficulty with desire or difficulty getting and staying aroused. So again, I like to write, and I do think that I have a tendency to be objective and analytical in my approach when it comes to these acts of self-examination. So if it were me, the first thing I would want to do is try and remember my previous sexual experiences, try and list them so that I can more fruitfully reflect on them. I'd then go through each experience individually and try to unpack or unwind each one using that stream of consciousness writing technique that I was talking about earlier. And after I did that, I'd then look at the experiences and what I can remember about them and try to identify patterns. Are these experiences similar? And if they are, could the similarities within these experiences be contributing to negative expectations surrounding sex and therefore low libido? And building off of the idea of investigating previous sexual experiences, it might be true that previous sexual experiences were traumatic. Whether you come to realize that you didn't fully consent to a sexual experience, or you're already very aware that you have a history of sexual abuse, your brain and body, because they are always looking to protect you and keep you safe, might now associate sex with threat and danger. Becoming aware of this association and recognizing that it's rooted in kindness, that it truly is the intention of your brain and the intention of your body to protect you from further harm, can be a really helpful first step in healing. I won't speak more about the mental health aspect of this because, again, it is outside of my area of expertise. However, I do want to speak a little bit more about the physical aspect of trauma. Imagine that I was going to punch you in the stomach. That is a threatening and dangerous act, and you'd want and expect your abdominal muscles to tighten or flex or contract in order to protect you from the incoming threat. Sometimes the muscles that live in your pelvis will respond in that exact same way to sexual trauma. They flex or spasm or tighten to protect you, and sometimes they forget to let go, or other times they think that they should now always tighten to protect you from any sexual experience, even if that experience is consensual and wanted. If you are experiencing pelvic pain, painful sex, painful arousal, painful orgasm, any sort of pain in that realm secondary to sexual trauma, know that those pelvic muscles can be retrained. And while a mental health provider could be of immense value in your healing, so could a trauma-informed pelvic physical therapist. If you think pelvic PT could be of use to you in your healing, I've also got a directory to help you find pelvic providers in your area in the description below. Finally, before we move into the last category, I did want to say that sexual trauma is not the only kind of trauma that could contribute to low libido or other forms of sexual dysfunction. There is such a thing as medical trauma. Medical pelvic procedures can be traumatic. Whether an examination was performed without your full consent or a procedure was unexpectedly painful, your brain and body could, as a result of those experiences, learn to associate any sort of pelvic stimulation with threat and danger. If you have a history of medical trauma that you feel may be contributing to low libido or other forms of sexual dysfunction, again, do check the description below for help finding mental health providers and pelvic providers to aid you in your healing should you choose to seek that form of therapy. Finally, if I were struggling with low libido and wondering if my psychology could be contributing to that struggle, I would want to investigate my mental health. Again, mental health is not my area of expertise, so I've collected 3 resources for you from the National Alliance on Mental Illness, the American Psychiatric Association, and the Mayo Clinic that might be able to help you identify what behaviors are normal and what behaviors, when clustered together, could be a sign of mental illness. What I will say is that low libido alone is not necessarily indicative of mental illness. However, low libido, when clustered with other behavioral changes, changes can be. And in that case, libido isn't likely to return to normal unless the larger disorder is treated. Before I end this video, I do want to gently remind you that you are worthy and deserving of whatever a normal libido is to you, and you are worthy and deserving of pleasurable sexual experiences if you want them. Doing this sort of work and this sort of self-reflection, trying to figure out if your psychology is contributing to low libido, can be really tiring and emotionally exhausting and demanding. Try to be kind and patient with yourself during this process, and while I know from my own personal experience how difficult it can be to ask for help once you've identified an issue, I do want to encourage you to ask for help if you need it. You deserve to feel peace in your body and peace in your mind, and asking for help can be a really powerful step towards that peace. On that note, thank you so much for watching. Please do let me know what you think of this video. As I've said, I'm approaching this series differently than I've approached other content, and I am very open to your constructive criticism and your feedback. So if you found this video helpful and you liked it, don't forget to give it a thumbs up, and if you didn't like it, please do give it a thumbs down. Feel free to comment absolutely anything down below. I do try really hard to read and respond to all of my comments, and as I said, I'm very open to constructive feedback, to criticism, and to content suggestions. If there's anything that you want me to make a video about, let me know down below. Don't forget to check me out on Instagram, and lastly, if you want to, please do subscribe to my channel for more content, not only about pelvic things like today's video, but also about life things. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.